In this video we're going to discuss very important points about a very important disease, that's Goodpasture disease or a Goodpasture syndrome. So you know about this, the basic points, the important points for USMLE examination. This is an autoimmune disease, affects both the lungs and the kidneys. So remember, the important point over here is it's an autoimmune, okay, and affects what you call the lungs and the kidneys. Okay, the antibodies that are very important in this disease is anti-GBM. What's a GBM? Glomerular basement membrane. Okay, so what is the characteristic of this syndrome is these people have what you call intra-alveolar hemorrhages and glomerulonephritis. So in USMLE, if they give the history and gives what you call the sign and symptoms affecting the lungs along with the kidney, then think of Goodpasture syndrome. Okay, so intra-alveolar hemorrhage and glomerulonephritis. So usually the patient of this syndrome presents with hemoptysis, that is a coughing of the blood. Okay, look for this symptom in the case scenario. Then dyspnea, and in patients sometimes they give the history of repeated or recent respiratory tract infections, right? Okay, so if you take out what you call the PFT, pulmonary function test, it shows a restrictive pattern. Remember, restrictive pattern. Okay, and the DLCO, okay, DLCO is increased. Remember, why? Because of the presence of high in alveoli. Remember, okay, the DLCO is increased. If you take out, because this syndrome, Goodpasture syndrome, affects the kidney also, so if you do the urinalysis, shows proteinuria and granular CAS. Proteinuria, passing of the protein through urine, right? And granular CAS. Okay, and if you take out the renal biopsy, it shows crescentic glomerulonephritis and IgG depositions. IgG deposition. Remember, okay, IgG deposition. Where it gets deposited? It gets deposited on a glomerular capillaries. Glomerular capillaries, right? And if you take out the chest X-ray, it shows a bilateral alveolar infiltration. Because of this, the membranes are involved of the alveoli. Because of that, you see intra-alveolar hemorrhages. So if you take out the X-ray, the chest X-ray reveals bilateral alveolar infiltration. Bilateral alveolar infiltration. How would you treat this? So remember, it's an autoimmune disease. So what you have to do is do the plasmapheresis. Okay, and other agents like corticosteroids and immunosuppressive agents can be used, but remember, for USMLE the important points is the plasmapheresis and the steroids. Okay guys, so this is just an idea about what you call the Goodpasture syndrome. Okay, so thank you so much for watching this video. Take care.